Interior Health collects patient information upon registration with our services, including whether or not someone is Aboriginal. Aboriginal includes First Nation, both status and non-status, on or off reserve, Inuit, or Métis.
There are a variety of reasons Interior Health asks about Aboriginal self-identification. Access or referral to an APN is one of them. Interior Health collects information about self-identification to better plan health services for Aboriginal patients and clients, to evaluate the accessibility of services to Aboriginal patients, to integrate traditional wellness and cultural supports for Aboriginal patients, clients, and their families, and to identify sites where services may need to be expanded or established. Self-identification will not negatively affect your care or the quality of services you receive.
ASI collection is private and voluntary.
Hi, how can I help you?
Hello, I'm here for a scheduled surgery.
Of course, let me get your admission process started. I need to ask you a few questions, and I will input this information into your electronic medical record, or EMR. These questions are asked of everyone and shouldn't take longer than a couple minutes. What is your date of birth? Who is your family doctor? Do you identify as Aboriginal?
These are multiple spaces in which you may be asked this question if you identify as Aboriginal. Once an Interior Healthcare team member has asked this question and entered this information into your EMR, this information shouldn't need to be asked again. It is important for you to know that you can request that this information be changed at any time.
Do I self-identify as Aboriginal? What kind of answer are you looking for?
You can answer this question however you'd like. This is a yes, no, or prefer not to answer question. If you select yes, you can choose to identify whether you are First Nations, Métis, or Inuit. If you select First Nations, you can choose to select whether you live on or off reserve and provide your status number. A status number lets healthcare staff know of your eligibility for certain medications, equipment, and supplies through the First Nations Health Authority, BC Pharmacare, and Pacific Blue Cross coverage upon discharge. If you select Métis, you can choose to select whether or not you are a member of the Métis Nation of BC, and this question is voluntary, and you can provide as much or as little information as you choose.
Are non-Aboriginal people asked this question too?
Yes, this question is posed to everyone, Aboriginal and non-Aboriginal.
I identify as Métis and am a member of the Métis Nation. Where does this information go?
This information is stored on your electronic medical record. Your care team, those involved in your circle of care, are the only ones who have access to this information. You can request to view your patient record at any time. All information collected is completely confidential and protected by the Freedom of Information and Protection of Privacy Act.
Okay, thank you.
Perfect, you're all checked in. How are you feeling about your surgery today?
I feel okay, a little nervous.
I see here you identify as Métis. Would you like me to introduce you to our Aboriginal patient navigator? Katie is available to support you before and after the surgery if you'd like.
Sure, that would be great.
Hi there, I'm Katie. I'm the Aboriginal patient navigator. How are you feeling today? How can I support you?
Interior Health is committed to closing the gap in health outcomes between Aboriginal and non-Aboriginal individuals. Aboriginal self-identification enables Interior Health and Aboriginal health organizations and communities to collaboratively work together to improve the health status of Aboriginal peoples living within the Interior Health region.
Interior Health, every person matters.